Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in this video, I'm going to show you exactly how you can tell if you have Piriformis syndrome or something else causing the pain in your butt. And my promise to you is if you stick around for this entire video, right, and you follow me through step by step through this diagnostic algorithm and process that I'm about to share, that this will be the most complete diagnostic tutorial that you will find. It'll give you more clarity than anything else, right? This video is perfect for you if you have pain somewhere in this red area. Now, you may also have back pain along that blue line. You may also have some leg pain, numbness, and tingling, but at least a portion of what you're experiencing must be somewhere in the buttock. Because if you don't have pain in the butt, then you do not have Piriformis syndrome. You can rule that out basically right away. If you have back pain, leg pain, though, and you're still wondering what the heck could be causing it, be sure to check out my Better Than an MRI DIY diagnostic guide. Now, in this training, here's what you're going to learn. Here's what we're going to share. We're going to loosely define what Piriformis syndrome is, so there's no confusion there. We're going to define what it is not via a process that I call diagnosis by subtraction. And this is a step-by-step self-diagnostic process for determining if Piriformis syndrome or something else is causing your buttock pain. Good news is no need for an X-ray, MRI, diagnostic shots, and definitely no need to see a specialist because I am a specialist, all right? So how do I say it with such confidence and conviction? I am and have gone through the trenches working with people all around the world with back, butt, and sciatic issues. There are lots of people who shoot content and tutorials on this topic about what to do and the exercises to fix it and how to figure out what's going on, but most of them are not specialized. So be careful who you get your information from. Again, if you're not aware of who I am, this is all I do. So this is based off of data. So there's some data to back this up, and I'm not just speaking blindly about this. You can see all my resources on the right side of the video here. This is based off 2022 data. At the time of this data collection here in the United States, there were 238,256 total licensed physical therapists. Within that, there are certain PTs who are, have specialties and are trained in different ways. Of those people who are doctors of PTs, are orthopedic board specialized, are residency trained, and only treat back, butt, and sciatica issues, we're talking this knowledge and experience places me in the top 0.5% of PTs in the United States, and obviously even more specialized if you look at the totality of the world. Now, I say this not because I know everything. In fact, I don't know everything, right? The more you know, the more you recognize you just don't know. But I do say this such that you can know that this information is legit, and this is coming from actual experience. I've worked with over 10,000 people with back, butt, and sciatica problems. We work with people all around the world. So again, this is a trusted resource, and I suggest you pull all the nuggets out of this conversation moving forward, all right? There's a 6-step process that we're going to walk through, again, in a flowchart fashion here in a moment to figure out if Piriformis syndrome is causing your buttock pain, and here they are. Step 1, how to rule out big, ugly, and scary causes of buttock pain. Things like cancers, fractures, blood supply issues, things like that. Step 2, how to determine if your mind or body is causing your buttock pain. It's actually way more common than you think. 99.9% of people, so that's you watching this, have been led to believe the pain in their butt is due to some physical damage, but it may or may not be. This is not woo-woo stuff. This is based off neuroscience and evidence. Again, the brain and or the mind can actually learn to experience pain and create physical pain. Step 3, how to rule out back and SI joints as the cause of your buttocks pain. Step 4, how to rule out the hip. Step 5, hamstring. So we can finally arrive at the most likely diagnosis of Piriformis syndrome. Do not skip these steps. You might be tempted to look at the bottom of this thing and say, dude, just get to the point, hit the chapters. You will be sorry. Do not do that, all right? Diagnosing Piriformis syndrome. What is Piriformis syndrome? Let's talk about it, and let's loosely define what it is. Of course, the definition, if you look all over the internet, is clear as mud. And this is probably why you're here, right? If you look around, this is what you get. Piriformis syndrome is a controversial cause of glute pain. Accounts for about 6 to 8% of patients who present with sciatica, problem with the sciatic nerve. And in the same breath, in brackets here, low back, leg pain in the distribution of the sciatic nerve. So is it sciatica or is it not? There's a difference, right? And the challenge in the treatment and figuring out if this is the cause, diagnosis of it, is that there are many things that can cause you to feel pain in the butt, but it's not actually due to a problem in the butt, a piriformis issue, for example. The back, the hip, the pelvis, other things can cause, again, pain to be felt in the butt, but it's not Piriformis syndrome. So this is a diagnosis of exclusion. Piriformis syndrome is solely a clinical diagnosis. It's a form of deep glute syndrome, and it accounts for about 0.3 to 6% of all back pain cases. Piriformis syndrome, again, is a clinical diagnosis. There is no gold standard in diagnosing it. MRIs, CTs, they cannot diagnose Piriformis syndrome. They instead are used to, again, there's that term, rule out, subtract other likely causes of what you're dealing with so that you can rule in Piriformis syndrome as the cause. Cool. So let me just redefine it here for you. What is it? Let's get clear on it. Piriformis syndrome, in my words, is a rare cause of deep buttock pain caused by something deep in the buttock that may or may not be irritating the sciatic nerve. Now, rare. If 100 people are watching this right now and you have pain in the butt, 100 people think they have piriformis syndrome. That's how you landed on this video, but only 6 actually do. So in comparison to other things, back problems, hip problems, other stuff going on in the body that can cause a pain in the butt, is actually pretty rare. Now, here is a gross dissection, if you will, of the structures deep in the buttock. That yellow stuff is actually the fat in your butt, in case you're curious, right? So we flapped away the buttock, and we're looking deep into the glute. Number 1 labels the sciatic nerve. Number 2 labels the piriformis muscle. And then you have some ligaments, you have the back of the hip joint, just lots of other things in this area. You can see how densely populated and complicated it is. And I say this to highlight the fact there are many structures besides just the piriformis that could cause pain and or irritate the sciatic nerve, right? Which is why we like to zoom out, myself and many other people included, and we prefer the term deep gluteal syndrome, DGS, versus piriformis syndrome. So if you see that on the algorithm, the flow chart as we go through, we're essentially talking about the same thing. We're just kind of maybe defining it a little bit more loosely, all right? And so we will go through this process of diagnosis by subtraction. By knowing what something isn't and ruling these things out, we can get closer to the truth of what something may be. So let's dive into it. All right, so let's dive deep into the flowchart and or algorithm to determine if piriformis syndrome or deep gluteal syndrome is the cause of your pain in the butt. We're going to go through the 6 steps. They are in this order for a reason. Do not skip these steps, all right? So step 1, we are going to rule out big, ugly, and scary causes of back, butt, and sciatica pain. This little red flag here is to indicate the presence of what we call red flags, all right? We are trying to screen for red flags or clusters of symptoms that may indicate that something more serious or sinister is causing your pain. This is important to do, all right? So things like cancer, fracture, again, blood supply issues. Let's go step by step. Cancer, right? Everybody wants to know, Dr. Charlie, is the cause of my back pain? Maybe it's cancer. I need to get an x-ray. I need to get an MRI. But do you really? All right. First things first, it's not very common. It doesn't mean that it's not serious. It's just not very common. All right. So everybody is worried they have cancer as the cause of their back pain, or lots of people are, but not many actually do. So 0.6% of people, there are 1,000 people watching this video, 6 of them will have cancer as the cause of their back, butt, or sciatic problem. So of people present to their primary care doctor with back, butt, or sciatic issues, 6 out of 1,000, or 0.6, about half a person out of 100, right, will have cancer as the cause of their issue, all right, cause of their pain. Now, this is sort of where I get my information from, so that you can review this if you want. But there are clusters of findings in the clinical exam, right, that point to cancer maybe being a cause of the issue, such that we might want to screen somebody for this problem, all right? So this is the test cluster that I use. So age greater than 50 years old. So are you greater than 50 years old? Do you have a previous history of cancer? Having a previous history of cancer shifts the probability that cancer is the cause of your back, butt, or sciatic problem greater than any of these other things, right? You have unexplained weight loss, losing weight for no reason. Have you not responded to other natural or conservative treatments? Right? Now, we don't take any one of these individual things and say, hey, you need to run off and get an x-ray or an MRI or more testing to determine if cancer is causing it or not, or to rule that out, right? There are lots of people who are 50 years old and have back pain, pretty much everyone, right? There are lots of people who have previous history of cancer and it's not the cause of their back or butt pain. There's lots of people who have tried other things like PT and chiropractic and things like that, and it hasn't worked. And it doesn't mean that something serious is causing their problem, meaning life-threatening, maybe in this case, all right? But look at this from this article. For example, cancer causing low back pain. Now it says low back pain, but realize back, butt, sciatica, kind of in the same wheelhouse. So we're going to extrapolate this a little bit. But cancer causing low back pain can be ruled out with 100% sensitivity if the patient, or you, is less than 50, does not exhibit unexplained weight loss, does not have a history of cancer, and is getting better with natural treatment, right? Again, we don't just take one of these things. We look at the cluster, right? So basically what that says is if you don't have any of these things present, you'd be 100% certain that cancer is not the cause of your issue. Now, kind of to put a rule on this for you, if you're watching this video and you have a previous history of cancer, especially one that has not been followed up on, you're not getting your routine checks, then I would go get that checked up on. All right. So if you have a previous history of cancer, knowing how much that shifts the probability that cancer may be the cause of your buttock pain that you're experiencing, I would get that checked up on if you have not. All right. Or if you check 3 of these 4 boxes, any 3 of these 4 boxes, we'll just say for the purpose of this video, then we should get at least a plain film x-ray and maybe, depending upon, again, the instructions of your primary care doc, some type of blood work to look for markers of inflammation. All right, so this is the test cluster. Do you check these boxes? If you check 3 or more, right, you want to go get that checked out. If you have a previous history of cancer alone, I am going to say, hey, go get that checked out. But if you have any less than 3, so 2, 1, or 2, or none of these, right, then the chance that cancer is causing your issue is very, very low. All right, so now let's move on. So we don't have cancer. Okay, what about a fracture? Let's talk about this. So again, here's some evidence. You could always check this out if you're kind of like a nerd like I am, all right? But let's talk about it. Here's the test cluster we use to, again, through the clinical history, when somebody's presenting to me, what do I look for to kind of say, hey, do we need more testing or do we not? Right? Do I treat and refer? Right? Or just send them out to get more imaging? Female. Unfortunately, fractures tend to be a little bit more prevalent in females, especially those who are a bit older. So 70 years old is kind of the cutoff that we look at, who have had significant trauma. All right. When I say significant trauma, it could be a trip or a fall. It could be a car accident. It could be maybe you stepped off the curb wrong and stumbled a few times. All right. Something we'll say significant, but we're probably not talking like hey, you were sitting there and you started to develop back pain for no reason. That's not trauma. All right. So we're looking for trauma here. Prolonged corticosteroid use. So maybe there's something systemic, some systemic inflammatory condition that you've been taking steroids for some prolonged period of time. Maybe you have asthma and you're constantly on prednisone or something like that. All right. That's what we're talking about because we know that steroids weaken bone. All right. Maybe even if you had lots of steroid injections in the spine, I might actually add that here because we do know that it tends to and or can reduce bone mineral density if you have too many shots in your spine in postmenopausal women. All right. So this is the test cluster, right, that we use. And if 3 or 4 of these, if you check 3 or 4 of these are present, right, then we refer out for medical imaging to rule out a fracture. And we're ruling these things out. Now, maybe you're not greater than 70, all right, but you're a young, otherwise healthy, if you will, female. And again, this can happen in males as well, but just know female, we're talking much more common. We're looking for something called the female athlete triad. So are you a younger, maybe high school, college athlete, something like that, who has an irregular menstrual cycle, right? Maybe you've missed periods in the past. We call this amenorrhea, all right? At least that's how I say it. All right, which causes and can contribute to reduced bone mineral density. Also, we'll see eating disorders commonly present within this triad. So maybe not eating enough food, maybe, again, some type of actual eating disorder. And I'm going to add in here, if you have buttock pain, some type of what we call positive hop test. So I've seen folks, who are younger female athletes, although I have seen this in even older folks, kind of middle age, but at the end of the day, irregular periods, eating disorders, or poor nutritional habits, reduced bone mineral density, less bone strength, more brittle bones, if you will. And, every time they run, they feel a sharp pain in their groin, their butt, their leg in that area. Well, many fractures happen in the pelvic region, all right? So if 3 out of 4 of these items are present, then we want to refer out for medical imaging to rule out some type of stress fracture. Most common areas of stress fracture in young female athletes, just stress fractures in general in athletes would be, say, in the toes as well as in the pelvis and kind of maybe hip area. All right, so something to consider. But maybe you're like, Charlie, I don't have that. That's not me. All right, you may have been tempted to skip ahead, but let's keep going. One more thing that we want to rule out, big, ugly, scary things. All right, vascular causes of symptoms. Now, again, I don't have any prevalence data on this. I have seen maybe 2 cases out of the 10,000 plus that I've seen. I stopped counting at that point because I didn't need to anymore. And we call this peripheral arterial disease. And so here's what you need to know. This is taken directly from that article, and here's what I look for. Age greater than 50 years old. If you're not greater than 50, then you pretty much probably don't have this, all right? Again, we're looking at probabilities here. If a vascular problem is causing your buttock pain, then we will see that it is exertional versus positional in nature, in the way that it behaves. So exertional symptoms will come on when you load the cardiovascular system more, when you exert the heart more, you place more stress upon the heart and the vessels and everything within that system. You will see that symptoms increase. And then when you reduce the load and the exertion to the cardiovascular system, symptoms will resolve. This is not positional or mechanical. All right. So let me be clear and let me give you an example. Exertional versus positional. Let's just say, all right, hopefully you can see me, that I'm walking. Look at my trunk. The position of my body does not change. I'm walking. And I start to get, after a certain amount of time, pain in my butt, maybe even in my calf or my leg. Walking. I feel the pain and I stop. I don't change my position when I stop, however. I'm standing in the same position. Position didn't change, but now my pain and my symptoms in my butt start to go away. Right? I didn't change any of my position in my body, but what I did do is I changed the amount of effort required of my heart and my cardiovascular system. I reduced the load on it, and my symptoms changed. So symptoms come on when I exert myself. I'm walking, stop, keep the position the same. Buttock pain, leg pain starts to go away. Walking. At a certain point, there it is again. When I stop, no change in my position, symptoms go away. That is a sign that peripheral arterial disease or something vascular may be causing the symptoms. And again, in totality, this entire algorithm, we don't just take one thing and throw someone in jail for it. All right. Versus positional. Here's an example of somebody maybe with classic spinal stenosis who feels buttock pain. All right. So walking. I get pain in my butt and in my leg. I keep walking. So I'm keeping the load on my heart. I'm still exerting myself. I'm not changing that variable, but I bend my body forwards. Charlie, when I lean on a shopping cart, now my pain goes away. It's weird. So again, we didn't change the load or the stress on the cardiovascular system, but we did change the position of our spine. Symptoms went away. Now I keep walking, or actually further exerting ourselves. Oh, and now the pain comes back. So it's positional dependent, not exertional dependent. Go back and watch that again if you need to. Most people with peripheral arterial disease as a cause of their buttock pain or leg pain have a significant cardiovascular history. We're talking things like high blood pressure, high cholesterol, diabetes, stuff like that. There is usually no clear mechanical reason for symptom onset. They don't say, hey, I bent over and picked something up and hurt my back. Right? Again, we're talking about a system beyond just the muscles and the nervous system and the skeletal system. Right? So there's no clear mechanical reason for symptom onset. Not of the mind or mechanical body. Right? So notice now there's an arrow here. So if you're watching this, you're like, hey, well, it could be that. It seems weird. I check off these things, right? Let's keep going because it could be something else. And something else might show up for you here that is more likely than that. Because again, we're not talking high percentages of probabilities here. Cool. Let's keep moving on. Mind versus body. Really cool topic here. Again, almost everybody in the world has been led to believe that all pain that they experience in their body is due to some physical damage or harm. But it's simply not true. All right. In fact, again, the mind and or the brain can actually feel pain and learn to experience pain. It can create what feels like very physical pain. It is very real, by the way. It's real pain. But at the same time, it's not actually caused by damage. So if the body is causing a problem, if there's a structural issue there, then the pain is probably due to damage. And we will talk about that here in a moment. But sometimes pain can just be a perceived danger. All right. So what are the signs of this? Let's zoom in and talk about it and go through and ask yourself kind of these questions, right? So did your pain start without clear injury? Was there no injury or perceived injury? Let me be very clear, right? Almost everybody, because they believe that all pain is due to damage, they try to link all pain to something physical, right? I think it was when I was working out. What do you mean you think it was when you were working out? Like if you break your leg bone right now, are you going to know what broke your leg bone or not? If somebody hits your arm with a bat or with, they give you a fist to the arm, are you going to be unsure about why you wake up with a bruise the next day? No, you're going to know. It's going to be very clear. But what happens is a lot of people try to blame why they hurt on what we call a perceived injury. They'll say, again, well, I think it was when I was running. I believe I hurt myself at the gym. I think I've just been sitting for too many years at my desk. But how many people injure themselves sitting still at a desk? I mean, have you ever seen that? Like someone just screams out in pain when they're sitting there working? No, that is a perceived injury. That is not a real injury. Pain starts without clear injury. Pain that lasts beyond normal tissue healing times, greater than 3 to 6 months. When we look at the evidence and we look at how long discs take to heal, when we look at how long bones take to heal, ligaments, joints, things like that, right? Most will heal. Physiologically, it's just the way the body is designed to heal. How many people here have had a paper cut and that paper cut has been present for 1 year, 2 years, 3 years? Now, you might have a scar, but that scar is evidence of healing, right? Everything in the body heals. Now, there are some things that may get worse over time, maybe some arthritic things. We'll talk about that here momentarily. But again, when you look at how long does it take for a disc to heal, roughly 75% of people with a disc injury will be better or mostly better within a 6-month time frame, most even before then. I've seen it maybe go to 9 months. That would be a normal expected healing time. If you fracture your leg bone, your arm bone, some other bone in your body, you break a bone, you're talking 8 to 12 weeks. You're not talking 8 to 12 years. So if all these things are designed to heal, why is it that you could be watching this and have pain for a year, 2 years, 3 years, 4 years? Well, this might explain it. Again, we don't look at one piece of evidence, we look at all of this. Did your pain start during a time of fight or flight, good or bad? Maybe you just graduated college. Maybe that's a good thing. Maybe it's also a bad thing. Maybe you just had a baby. You're like, oh, that's a good thing. I wasn't stressed out. It was great. Well, I mean, I have a baby too. It's a little stressful. Maybe you just lost a job. Maybe you just lost a relationship. Maybe you just lost a loved one. Good or bad. A state of fight or flight. Is your pain inconsistent? Do you have some good days or bad days? Now, problems within the body can create pain that varies. We'll talk about that again in a moment. But do you have no reason, right, for why you have some good days and bad days and this and that? It's just kind of all over the place. Is it weird? If it's weird, it might be wired. Does your pain change with stress? Charlie, I have a pain in my butt. And when I sit at home next to my Christmas tree or with some nice music on or at home with friends and family, I feel pretty good. Low stress environment. But then I can sit in that same exact chair at work and my pain gets worse. Does your pain change with stress? Maybe related to work, maybe related to something else. Something to consider. Do you have relief of pain with distraction? Pain is a great preoccupier. It's fueled by attention and fear, worry and concern and anxiety. But when you place yourself in a joyful state, when you're with friends, eating dinner, when you're on vacation and your pain miraculously feels much better, that's weird. Your body didn't change when you were with your friends. Your body didn't change when you went on vacation. You starved pain of its fuel, fear and attention. Multiple body symptoms. And not just in the musculoskeletal system, with the muscles, the joints, the bones, right? The nervous system we're talking about here. Maybe you do have some neck pain. Maybe you have some shoulder pain. Maybe you have some knee pain. But maybe you also have some GI symptoms. Very common that people have like irritable bowel syndrome and other things that seem like they're another problem. But is it possible that it is all related? Do you have multiple body symptoms? Do you have pain that shifts, spreads, or moves around? And again, for usually unknown reason. Hey, it was on the right side, and now I don't know why, but now it's on the left side. And now it's here, and now it's there. And now it was in my butt, but now it's in my back, and now it's in my mid-back. This is weird. Delayed onset of pain, kind of like I alluded to earlier. If someone punches you in the arm, if you fall, you will feel pain immediately in the moment. If it's a structural problem, there's no question about you breaking a bone right now. You would not be unaware as to what caused that. And you would not feel no pain in the moment. You would feel pain in the moment and later on. But if you go running and you don't have pain while you're doing it, and then 24 hours later, 2 days later, symptoms flare up, then that doesn't make sense. It doesn't make sense that you damaged your disc or your muscle or your nerve and you didn't even know about it. The body didn't let you know about it. It lets you know about everything else. Why is it that your symptoms are delayed? It's inconsistent. It's one piece of evidence that is inconsistent with a structural cause of pain. Have you been given many or no clear diagnostic labels? So I see this all the time. People come in with 10 different diagnoses because they've seen 10 different specialists. Why do they get so many labels? if you're getting so many different labels, it's because nobody can agree about what's happening, because nobody actually knows what's happening. All right, until you watch this video. Or no clear diagnosis. Hey, we don't really know what's wrong with you. We've gone through your X-ray, we've gone through MRI, we've done all these tests, and they've all panned out to be good. That's weird. Don't you think if there was like a broken bone there, they would have found it? Maybe they're not finding it for a reason. Maybe it's not of the body. Maybe it's of the mind. Again, doesn't mean you're making it up. Very real stuff that we help people with every single day. All right. Are you somebody who sort of has these habitual trained personality traits? Are you someone who's high pressure, perfectionist, type A, people pleaser? Charlie, just tell me what to do and I'll do it better than anybody else. I'll do whatever you tell me to get better. I hear you. Probably worked well for your career, probably worked well maybe for finances, probably works well maybe in a relationship, but is not going to serve you well when you're getting out of pain. In fact, what does all this stuff do? It increases your fight or flight state, puts you on more high alert. Unclear movement pain relationship. Charlie, I don't think you can help me because I've gone through some motions that you provided online. I've gone through your different tests and nothing makes it clearly worse. It's just kind of random. Yeah, it doesn't mean we can't help you. In fact, it means we can help you. All right. Just because you don't understand why something happens doesn't mean that there's no reason for why it happens. This is why you reach out to a specialist or someone like myself who has lots of experience in decoding this problem and helping you put the pieces together. It might not make sense to, say, a chiropractor or an orthopedic doctor who only sees things of the body. This is most of the world. But this is why you are here, and you can find someone who understands not only the body, but then also the mind. And so again, we leave no stone unturned. We give you the best chance of not only figuring out what's causing it, but then also solving it. I can't find yucky motions, unclear movement pain relationship. Or sometimes this hurts and sometimes it doesn't hurt, right? Yummy isolated motions versus yucky integrated. What do I mean by this? Yummy isolated motions, yucky integrated. Charlie, let's just take running, for example. What is running? Well, running, you got to put your arm like this, your arm like this. You twist right, you twist left. You got to bring your one leg up, your other knee up. You got to kick your one leg up, your other leg back, your other leg forward, your other leg back, right? There's all these different motions that make up running. You got to be able to hop on one leg, hop on the other leg. So Charlie, I can do all these motions and they don't cause me any problem. But when I run, I can't run. That's weird. You can do all these little building blocks which make up running and you have no problem. But then when you put them into running, you have a problem. That's weird. That's not making sense. Charlie, I can do a knee to chest. I can kick my leg out. I can bend forward all different directions, but I can't sit. That's funky too. Or something really obvious in case you're not picking up what I'm putting down, right? Charlie, I can raise my arm up all different directions, no problem. But then when I go to grab the cup out of the top cupboard cabinet, I can't do it. So there's this integrated activity, or when I go to work and I'm using my arm like this, I can't do it. But I can do this right now if you ask me to as much as you want. Again, it doesn't make sense. Things aren't adding up. This is why you need a good detective to help you figure out what's going on. Exercise that feel good now and worse later. If you're going to PT, right, the exercises, let's just say they give you, by the way, don't do a sheet of exercises because you'll never know what the heck is working. That's like the worst approach to solving this. But let's just say you go to PT, right? And PT always flares me up. It doesn't work. But I feel fine when I'm doing it. But then symptoms are worse later. If you're damaging something structurally, you're going to know it in the moment. This goes back to sort of the delayed onset of symptoms. Chances are they're overloading the nervous system, stressing you out, making you more fearful, worried, and doubtful. They're having you do things, right, which increase the level of threat within the system versus safety, and nervous system on overload. Later, it catches up. And lack of response to physical treatment. Unfortunately, this is where we catch a lot of people. Roughly 25% of people that we work with have seen, actually 25 plus 7, what is that? 32% of people that we work with have seen more than 5 practitioners prior to finding us, all right? So these are the people who tried everything. We do see many other people as well, but people will oftentimes not be open to the possibility of their mind creating symptoms, even though this is, again, not woo-woo. We're all humans. We're very emotional creatures, and we know this can happen. People will often not be open to this as a possibility and will fight it tooth and nail until they fail enough physical treatments because they believe that they must have missed something and there must be something there. Right? So I've seen people who get 5 MRIs, 6 MRIs, 10 MRIs, seeing 15, 20 people before they finally say, you know what, there might be something to what you're saying here, Charlie. All right, so something to think about. All right, now, if you go through this and you check off all these boxes, or many of these boxes. Again, we don't need everyone, but many of these boxes. And you're like, this is kind of weird. This is interesting. This guy's speaking my language. All right. He's talking about me. Then holy smokes, your mind could actually be causing the pain in your butt. Again, very real, but the mind can cause manifestation of these physical symptoms. All right. And here's the cool thing, right? It's not unfamiliar to us. We actually go through a process of helping identify and making sure this is the cause of the issue, right? Helping you self-assess, teaching you to use mind and movement as medicine, and getting you back to life. By the way, if you're interested in that, at any point as we go throughout this video, just click the apply link in the comments or somewhere pinned there in the description area. Again, we work with people all around the world. The goal is to teach you how to use your mind and movement as medicine. You can click on that link, set up a time to chat with us, and then submit details of your case via what I call a case review. I will review the case personally. If I feel like I can't help, we cancel the call. We'll just let you know if we feel like we can help. And guess what? We can talk about what that looks like. Okay, so hopefully that sounds fair. Go ahead, check that link below if you're looking for some help. All right, now let's talk about the body. Right? This is where most of the world will fall, at least within their current understanding or worldview of what pain is and what it means. All right, pain equals damage. Charlie, there's got to be a disc problem. There's got to be an SI joint problem. That's what I was told. I believe it. Boom. Okay. So if symptoms are of body origin, structural cause, there will be a clear injury and cause of pain. You're not guessing. Remember, we talked about a perceived injury on the mind side of things. You're not saying, well, I think I maybe heard it when I was running or lifting weights or at work, whatever. There's a clear injury. There's usually a recent onset of symptoms, all right? So this is somebody who maybe just bent over, picked something up, and they threw their back out, right? Again, in line with more of a structural cause of symptoms, most likely. So more acute, if you will. There's a clear and consistent movement-pain relationship. When I do this leg raise, when I twist my trunk, when I do whatever, it hurts, and there's no question about it. Not sometimes, or maybe. It's consistent. And there is a clear agreed upon diagnosis. Now, you don't need an X-ray or MRI. You could just ask these questions and go through this process that I'm about to show you, and you can figure out the most likely cause of your pain. All right, and we can agree upon it. So again, if that's the case, and this sounds more like it, then we will go through ruling out the back in step 3, the hip, the hamstring, arriving at Piriformis Syndrome. All right, but look, maybe you're somebody who's in the middle. You're like, this is weird stuff. Right? And I'm not sure. Maybe it is of the mind. Maybe it is of the body. What the heck is going on here? Then I told you this would be the most complete diagnostic tutorial. If you stick around, you do what I ask you to do. All right, I'm going to hook you up. So I want you to have something we call your evidence list. All right, so you can see here that, and I'll actually pull this up here in a moment. There's a bunch of different questions that we outline. Right, you can actually answer these questions, and it actually gives you sort of a printout or a probability. All right, and here are the cutoff scores. If you go through this evidence list, which I'm about to show you in a moment, and you score 62% or higher on the mind, pink, if you will, in this case, right side of things, then we're going to say, hey, symptoms are of the mind, not of the body, right? Vice versa on the other side of things. If you score 46% or higher on the body side of things, then we will say that is of the body. There's a reason I created these cutoff scores. All right, so you just have to trust me on this. But again, you can get your hands on this evidence list by downloading my DIY diagnostic guide above. So this way you are not unclear, but instead you can walk away with this with a ton of clarity and know exactly which way you need to go. If of the mind, we can help you with that. You can apply to work with us if you'd like. If of the body, right, then we keep going down the path. All right, so I want to show you, again, just sort of a sneak peek of this evidence list. Again, you can get access to this evidence list and to this document. Actually, you can make a copy of it and use it for yourself so that you're clear about what could be causing your issue. I give you some instructions. I take all the pieces of evidence, I put them into a question form. Cool thing is I give you helpful tips as well as like real life examples of people who thought they had symptoms of the body, but actually had it of the mind, and they allowed me to share it with y'all so that you can go through this process for yourself. And again, you've got little drop downs. You can change what these drop downs say. You can actually include some of your own little notes about anything. So this way you have everything recorded for yourself, right? You can see here, it actually gives you sort of a printout, if you will, of the probability your symptoms are of either body or mind origin. So check it out, download that DIY diagnostic guide. All right, so let's just say that, hey, Charlie, symptoms are of body origin. There's a structural problem going on here. I know it because either it's very clear just upon reviewing this big picture, or I went through, I copied your evidence list, right? And bam, the majority of my symptoms, the vast majority of my symptoms are of pointing towards a structural problem. Great. So we have the back, we have the hip, we have the hamstring, we have lots of different stuff. Let's do it. All right. So third step, rule out back and SI joint as the most likely source of your issue. So in order to do this, we can just move the back in multiple different directions. You would be surprised by how many people have a pain in their butt, but they say, I don't have any back pain. Therefore, Charlie, it can't be my back. It could be your back. Let's move your back, right, and see if it reproduces the pain in your buttock or changes it. All right. So you can see sort of like a clock here, right? You can go forward, backwards, right, left, and in multiple different in-between directions. And so let's do it. So what I would say is you can either stop this video, pause this video, go back, but this is how I want you to move your body. First things first, let's go forward, seated in a comfortable chair. And by the way, if you're worried that you're not getting a clear read on how this is impacting your buttock pain because you hate sitting and the pressure on your buttock is just too much to bear, then hang the buttock. Shift your weight so your buttock is actually hanging off the seat. So this way you remove the compression component and instead you're just looking at the mechanics of how you're moving your spine. Sort of a ninja tactic diagnostically there. All right, so you're gonna go forward and again, disclaimer, if you've been told for some reason you have brittle bones or something's weird and you're like, I just can't do that. Somebody said absolutely no. Okay, that's fine. I would still question it maybe, but either way, the goal of this is not to harm you. It's just to have you go through a screening process to rule out the back or the SI joint. Okay, so first things first, go as far comfortably as you can here. And you're asking yourself as you go throughout this process, does bending forward change or reproduce the symptoms in my buttock? Go straight forward. Right? Then what you're going to do is seated there, you're going to go over top of your right knee. Sorry, forward to the right, forward to the left. All right, so we've got central, forward to the right, forward to the left. Now what you're going to do is you're going to go the opposite. So now you're going to stand on up, feet shoulder width apart, put your hands on your hips, however you want to do it. Bend back as far as you comfortably can. Straight backwards. Does that cause pain to shoot into the buttock? Now you're going to rotate to the left first. So watch me. Rotate to the left and then bend straight back. Rotation extension test. Basically, we're kinking down on the corners, the joints and the structures in the corner of the spine on the left side. And then, after you do that, rotate to the right and extend back. Twist straight back. Does that cause any type of pain or problems? If you find that one of these does, oftentimes one of these backwards to the left or backwards to the right will shoot pain in your buttock, then you don't need to go through the other motions. Moving your back reproduces your buttock pain. It's a back problem. But if still not clear, you can stand, kind of shift your hips the one way. So kind of taking your shoulders and taking your hips and you're kind of gliding that way. And go the other way, a side bend or what we call a side glide to the right and side glide to the left. So now you've moved your back in all these different positions. And if one or more of these back motions reproduces your pain in the butt or leg, then you do not have Piriformis Syndrome. This is very common. You have a back or SI joint issue referring to pain in your buttock. Oftentimes you'll see these rotation extension tests kind of pinch down in the SI joint as well. All right. And again, it could be a disc problem, a facet joint problem, an SI joint problem, but potentially a muscular problem or some other tissue in the back. Point being, we can help with that, right? And we probably don't even need to get this minute as far as the diagnostics, but at the end of the day, it is a back issue. So you can probably stop this video. And if you are interested in potentially working with us, at least having me review your case, click the link in the comments. All right. Now, let's just say you're like, hey, they're good. Not a back problem. Aha. Okay. Well, what else could it be? If none of these motions reproduce your butt or leg pain, then we go to the next step to rule out the hip joint. Again, many people believe they have Piriformis syndrome. You might be one of them watching this, but they actually have a problem in or about the hip. So first things first, location-wise. Piriformis syndrome and hip joint problems can refer pain to the buttock. So the location alone is not all that useful if you just have a pain in the butt. But Piriformis syndrome will not cause pain on the outside of the hip. Maybe you've been told you have bursitis, right? And or it will not cause pain in the groin. So if you have buttock pain with outer hip pain, or buttock pain with outer hip pain and groin pain, or buttock pain with groin pain, then the chance that Piriformis syndrome is causing your problem goes way, way down because we know that the piriformis muscle does not refer to the outer hip or the groin. Other things might, but we've already ruled out, like the SI joint, for example. We've already ruled some of these things out in this sort of phase back here, all right, in step 3. So hopefully that makes sense. All right, again, if you've got multiple areas of symptoms, including the groin, outer hip, buttock, then automatically it points to it not being a piriformis syndrome issue, right? So I'm going to ask you here, if you're watching this, do you also have outer hip or groin pain in addition to your buttock pain? If yes, then chances are high you have a hip problem. Hip osteoarthritis, hip labral tear, stress fractures, something like that in or about the hip joint. Just kind of, not to get too off track here, we just kind of labeled some of the criterion or cluster of sort of findings that people with hip OA or osteoarthritis within the hip joint sort of describe, right? So age greater than 50, there's groin pain, there's usually limp. The further I walk, the more I limp. There's what we call a positive sock test or a toenail test. So when you're trying to put on your shoes, you're trying to like get up into that figure 4 position. It's just painful, limited, and restricted. You can actually confirm that here by seeing what limited motion looks like here in a second. Right? So if you're not sure, stick around. And then oftentimes people have trouble sleeping due to hip joint problems, and it's getting worse over time. Less motion over time, more limping over time, more pain over time. This points to maybe not being responsive to a natural solution, potentially needing some type of hip replacement, but it definitely does not point to a piriformis syndrome problem, right? So now let's just say that you've just got buttock pain, all right? So you don't have pain on the hip, you don't have pain here, it's just buttock pain and or some leg pain. Remember, you might have some other stuff, but it's definitely not going to these areas. Do you have limited overall hip motion on your painful side? This is, you're going to want to probably rewatch this. This is sort of a new concept for many people who will watch this. And we want to look at the total arc of hip motion. I'm going to describe exactly what that means. So do you have limited and often painful overall hip motion on your painful side? We're not just going to look at one direction. We're going to look at the total amount of motion available within the hip joint, right versus left sides, right? So here are some examples of motion that is fairly symmetrical. So I would not call this limited hip motion. And remember, we're comparing right versus left side. So you're kind of your own little test here, all right? And so what we're going to do now is we're going to show you how to determine if the total arc of motion, right versus left, is symmetrical or not. Right, so here's the test that we would go through, and here are some examples so you see exactly what I mean, and you can kind of relate to this, right? So first things first, this is an example again of symmetrical or relatively symmetrical motion side to side. So left hip versus right hip. This is my daughter, super cute, all right? Left hip, you can see, just to be clear, her leg is kind of rotating in, but this is actually rotating the hip joint out. It's spinning the hip joint out. So we call this hip external rotation, left versus right. You can see on the one side, just drew some angles there, roughly. You don't need to get out some measuring device or anything funky here. Just look at it big picture. We'll say 40 degrees of hip external rotation on the left versus 35 degrees on the right. Now, again, her leg's going out, but this actually spins the hip bone in, so we call this internal rotation. And she's got roughly 30 degrees on the left and 25 degrees on the right. You can see a slight difference here, but nothing major. So if we take the totality of these arcs, this one and this one, we kind of glue them together, you can see again that she has on the left side 40 degrees out and 30 degrees in, which gives her roughly 70 degrees of total hip motion on the left hip. Now, on the right hip, we put those together, and she's got roughly 60 degrees of total hip motion. So you could say, if you really want to be nitpicky, that is not identical. But I'm going to say, look, that's within sort of what I would consider to be fairly symmetrical. It's probably not something you're going to pick up with the naked eye. All right, so I'm going to call it symmetrical or same motion, right versus left. The total arc of motion is the same right versus left. All right, now let's look at another example of symmetrical hip motion. Left hip, external rotation, 45 degrees. Right hip, 45 degrees, roughly. Left hip, 25 degrees internal rotation. Right hip, 25 degrees internal rotation. She's very symmetrical. This is my wife. All right. So 70 on the left and 70 on the right. Pretty darn symmetrical. Now, this is interesting because this is where most people get fooled. All right. So if you watch lots of different videos, you'll see that, hey, just check this motion. Go through this test. And if you're restricted here, it means that your piriformis is tight, or you need to stretch it, or you need to do this, or you need to do that. This is like the long versus short piriformis syndrome debate. Watch this, and it'll clear up a lot of confusion, all right? So left hip versus right hip. This is me. This is Charlie, all right? So you can see, and this is my natural motion. I'm not having to josh this for the video. All right. So left hip, external rotation, 45 degrees. You can clearly see that it's definitely different, clearly different than my other hip. So my right hip has about 30. Now here's where it gets very interesting. You have, if you look at the total arc of motion on the left side, 70 degrees of total hip motion. And on the right side, you have the same motion, 70 degrees, again, total arc of motion when you put the two together. So everybody wants to say, oh, this hip is tight because you can't move it that far, so we need to stretch it. Do not stretch this hip out. I was either born like this or I developed like this due to something I did growing up, or this is just the way I was meant to be. Right? So this would point to a structural change within the hip that is not going to respond well to stretching. The motion is the same. This is not a tight or painful or restricted hip. In fact, the motion is symmetrical. Now, where I get the motion, one way or the other, changes a little bit, but the total arc is identical. Tricky stuff. Pretty cool. Here's the cool thing. You can do this on your own. Just go through this process. So the motion is pretty much the same. If the motion is pretty much the same, you can say, hey, probably not a hip joint problem. Let's go to the next thing. So we'll get there in a moment. Now, I did have to fake this one. Let's just say the motion is limited and painful on the side where you hurt. Here is what it would look like. And again, this would be very clear and evident. It would probably reproduce some pain in the butt or the groin or the outer hip. And again, it would be clearly restricted. So in this case, this is an example of a restricted and painful right hip joint. All right. So left hip, got about 40 degrees of rotation. I've got about 40 degrees of internal rotation. So external versus internal. On the other side, I'm jammed. I definitely can't cut my toenails. I can't put my sock on. It's hard to put my shoes on. This hip is really stiff and again, probably painful. And going the other way isn't much better. So when I glue these angles together, you can see that on the left hip, I have roughly 80 degrees of hip motion. And on the right hip, I have about half the motion, about 40 degrees. So again, you don't need a measurement device to look at this. You can just say, hey, yeah, both ways, out and in, are restricted. When I compare that to my other out and in, it's significantly less, and it's painful. This is an example of asymmetrical or different hip motion, and the right hip in this case is clearly limited and probably the painful one. If that is the case, are you sure you don't have a hip problem? Right? Again, you can download my DIY diagnostic guide if you want for more info there, but this is something we see commonly. Okay. Now, to keep things going, nope, motion is pretty much the same, not a hip problem. Great. Now we need to rule out a hamstring problem, usually a problem with the high hamstring. So let's look at, again, the location of symptoms. This is very telling. So you can see here in this little sort of drawing that the hamstring attaches right to the butt bone. And if we look at the location, they differ. If you have Piriformis Syndrome or deep gluteal syndrome, you have symptoms in the center of the buttock. But if you have a high hamstring problem, the pain is localized to the sits bone, meaning you're not pressing smack dab in the center of your buttock. Instead, you're central in the middle, if you will, of the leg and the buttock, but it's much lower, or at least a few inches lower, where you're kind of taking your hand underneath sort of the cleft, if you will, of your buttock, and you're pushing on a bone, because this is where the hamstring attaches. The piriformis muscle is much higher in the buttock than the hamstring. So again, if you're watching this, you might have said in the beginning, hey, I do have pain in my butt. I think this is for me, but is it really? Are you sure you don't have a high hamstring issue? Location matters, right? And you may get a little radiation into the top part of the thigh. Now, let's just say you're watching this and there's a chance you have pain here on the sits bone and into the hamstring a little bit, but you also have pain in the center of the buttock. The chance you have a high hamstring problem causing it is pretty much non-existent, all right? Because you will not see a downstream problem, meaning pain below the center of the buttock, cause pain upstream. Another way to think about it, so if you have pain here and here, upstream problems cause downstream effects. So the piriformis muscle and the sciatic nerve can absolutely cause you to feel pain here, but a hamstring problem will not cause you to feel pain up above. Things will not refer upwards whenever it comes to referred pain patterns. Okay. So another question you may want to ask yourself to further rule out whether or not your hamstring is the cause of your buttock pain is to ask yourself if you experience any numbness or tingling. If you do, then the chances a hamstring problem goes way down because the hamstring is a muscle, not a nerve. And so you can be more certain that it's a nerve issue. Now, here's the cool thing. We know that the nerve issue is not likely caused by something big, ugly, and scary, because we went through all the evidence and all the different clusters to help you identify that. We know that it's likely not of the mind, but instead of the body, because we gave you the tools to figure this out, right? We know that it's not the back because we went through a bunch of different tests. We know that it's not the hip, and now we're here, all right? So if it's not something big, ugly, scary, not mind, it's the body, it's not the back, it's likely not the SI joint, it's not the hip, it's not the hamstring, something nerve-related still, what could it be? And this shifts the probability towards it being piriformis syndrome or deep gluteal syndrome as the cause of your back, butt, or sciatic issue. And you should feel highly confident about that, okay? Now, let's just say you're watching this and you're like, hey, I don't have numbness or tingling, but I'm still not sure. Maybe my hamstring is causing the problem. Then what we can do is we can perform additional testing, which we'll do now, to help you determine if your sciatic nerve is sensitive. And just be sure about it, all right? So here's what we're going to do. We're going to perform the straight leg raise test to rule out nerve sensitivity causing your pain. Basically, if you do this test that I'm about to show you in the order I'm about to show you, and it does not cause you pain or problems, then you do not have sciatica. You might have piriformis issues, but you don't have piriformis issues causing nerve sensitivity or sciatica. All right, so let's do it. What you're going to do, you're going to sit. Again, you can't tolerate the pressure, hang your butt off a little bit, all right? You're going to sit here, just kind of relaxed, all right? And you're going to straighten the leg, this is on the painful side, with your foot or toes completely relaxed, foot and toes completely relaxed. And if it's a hamstring problem, there should be no pain other than the possible pressure of sitting. All right, bear with me. Now, let's just say that you do that. You do just that. Even your feet and your toes are relaxed, but still, ouch, yikes, that hurts and causes my butt or leg pain. Then this points to most likely source being some type of sciatic nerve irritation. If the back, if the hip, the mind, if something big, ugly, scary isn't causing sciatic nerve irritation, what could it be? Boom, we're back here. Now, let's just say you do that. Maybe we haven't kind of pulled on the nerve enough. Maybe we haven't gone deep enough with our testing. So if there is no pain or problems with this, great. Let's be sure. Let's go one step further. Now I want you to get back into that position with toes relaxed. So while you're holding your legs straight with your toes relaxed, I want you to pull, you can do this slowly, your toes slowly towards your nose. You will definitely feel more of a stretch in the leg. This yellow line represents the sciatic nerve. So you can see when your toes are relaxed, that sciatic nerve has a little bit of slack to it. But when you pull your toes to your nose, you create tension on that. This should not increase your buttock pain. If your buttock pain worsens with the toes up, so you pull your toes up and you notice, ouch, that hurts my buttock pain. But it goes away or lessens clearly. Remember, we're not splitting hairs here. Clearly, it goes away and is not there when you point your toes. Relax foot, like this. Then it's likely a nerve issue, not the hamstring. Now, how can I feel confident saying that? Let me just explain again. When you pull your toes up towards the ceiling or towards your nose, if that causes the pain in your butt, but then when you point them, meaning relax the foot, and your butt pain goes away, you're not moving your hamstring at all. You're not changing the condition of your hamstring muscle. You're literally just wiggling your toes. What connects the butt to the toes? This yellow line, the sciatic nerve. All right, so again, when the sciatic nerve is on slack, toes are pointed. If when you pull your toes up, it puts more tension on the sciatic nerve and you feel pain in your butt, then this points to some form of sciatic nerve irritation. Because we've ruled everything out as the most likely source, points to most likely piriformis syndrome, right? So if you say, ouch, yes, pulling toes up worsens my buttock pain, but my pain lessens or goes away when I relax my foot, then again, PNP, just in case you're a clinician watching this, or maybe you're just a curious George like I am, peripheral neuropathic pain, in this case, sciatica, sensitivity of the sciatic nerve, the peripheral nervous system, points towards most likely cause being something deep in the butt, piriformis syndrome, deep gluteal syndrome, or if you go through this test, say I feel tight, but it does not reproduce or increase my buttock pain, then could it still be a hamstring issue? Good question. So now we're going to do a test to actually activate the hamstring muscle while leaving the sciatic nerve on slack because the knee is bent. And so we're going to do something I call a heel dig test. So what I want you to do is I want you to lay down, put your painful side at about 90 degrees, your hips about 90 degrees, your knees are about 90 degrees. You can put your heel on the edge of a chair, on the edge of an ottoman, on the edge of a yoga ball, a desk. It doesn't really matter. Hopefully your desk isn't that short. And you're going to slowly build up and contract as if you're trying to crush that chair or that ball or that surface, as if you're trying to dig the heel into it. Build it up, push, 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 build up the pressure. And if you say, ouch, Charlie, that hurts. And where does it hurt? It's going to hurt right here on the buttock. It's going to hurt, if it's a hamstring problem, right here, right on that little sits bone, and maybe you'll feel some pain that kind of draws into the high hamstring area. If you say, Charlie, that heel dig test, youch, and it points to an issue with the high hamstring tendon. And again, here's sort of the presentation, if you will. Hurts to sit on hard surfaces, right? So harder chairs because of the direct pressure of the sit bone on the surface. There's pain at the attachment site of the hamstring, just like we talked about in the location of symptoms. Oftentimes walking uphill, running, deadlifts, so RDLs, will increase pain. Why? You're increasing the amount of effort or load or force that is sent through the muscle tendon unit. The hamstring is a muscle, and high hamstring tendon, tendons connect the muscle to the bone. And when you contract the muscle, that force goes through the tendon, which connects to the bone, which allows you to move, pulls on your skeletal system. In these activities, you're requiring more horsepower and or force transmission through that hamstring muscle tendon unit. The more you stress out the hamstring, the more the hamstring tendon says, ouch, structural problem in the butt. And it's most common if people are younger and active, so athletes. Maybe you just increase your running mileage. Maybe you play soccer. Maybe you play some other agility sports or CrossFit or something where you're loading the tendon repetitively. And again, there's no numbness tingling because it is a muscle, it is not a nerve. If you are watching this video and you're like, hey, I think I have a high hamstring tendon problem, Charlie. I don't know why I started to get pain and I'm 65, 70 years old and I'm sedentary and I don't do any activity, but somebody's telling me I have a hamstring issue. They did a test, they saw it. Well, maybe the hamstring issue showed up on an image because you used to be a runner or just because you've lived a life well lived and been active. If you're sedentary and you don't know what started this problem, then the chance you have a high hamstring tendon problem goes way, way down, right? You're not going to get one of these problems from just sitting on your butt too long and not loading the tendon. There's usually something consistent within the story or the reason why you hurt that is usually related to some type of running, active type of onset, all right? Now, let's just say you do that heel dig test and there are no pain, no problems. You did the straight leg raise test, you did the heel dig test, no pain or no problems, boom. We have accomplished what we have set out to do, which is now we can feel pretty much fully confident or as confident as possible that the most likely, again, we're talking probabilities, source of your symptoms is due to either what we'll call Piriformis Syndrome, or if you want to speak more broadly, which I would recommend, deep Gluteal Syndrome, and you can stop. This is the end of the algorithm. This is the end of the flow chart. Right? Now, you might be watching this. Okay? Hopefully, I lived up to the hype of saying this will be the most complete diagnostic tutorial if you have some type of buttock pain, if you're wondering if you're Piriformis Syndrome. If you're like, okay, great, now what do I do? Because it was my back, or it was this, or it was that, right? Or maybe it's Piriformis Syndrome, right? What do I do? Well, luckily for you, right, we've helped a few people out with these issues, all right? And the goal is to teach you how to resolve this back, butt, or sciatic issue by teaching you how to use the power of the mind and movement as medicine so that you're not relying upon others to fix you. There is a process that we go through, and we work with people all around the world. We can teach you to solve this problem, right? Step one, we need to optimize things mentally and physically. Mentally, if there's certain beliefs, fears, worries, concerns, right, around your pain, it's going to increase the fight or flight reaction, which could increase or fuel pain. We talked a little bit about that earlier. All right. Physically, if there's certain habits, usually you don't know what you don't know. There's certain habits, routines, things you just don't even know that you're doing in your current day-to-day life. You could be nicking the scab or keeping yourself from getting better. Scary thing is lots of times what people have been told to do this stretch, do this, do that stretch, strengthen it, I don't know, do the McGill Big Three, something like that. I'm not hitting on anyone specific, but a lot of times what people have been led to believe is good to solve this problem is actually keeping them from getting better. So how do we figure out and do the detective work needed to resolve the pain once and for all? Step one. Second step of the process, teach you how to self-assess. You can't manage what you don't measure. So you can't out-exercise the bad diet. You can't manage what you don't measure. Imagine trying to build a house without a level or without a tape measure. It would be really darn difficult. All right. And so you've got to have some way of tracking things so you can determine what's working, what's not working versus kind of this random in, random out, trial this stuff and see what happens. Third step is mind and movement as medicine. If you're doing many different things at one time, then there's too many cooks in the kitchen. You're never going to be able to identify the one or two things that are going to work best for you. So how do you do that? We teach you a process so you can identify immediately in the moment if something's working, if it's a waste of time, or it's going to make you worse. And finally, we teach you a process for getting back to life. A to Z, we bring you full speed so you're better than where you even started. All right. Now, again, if you're interested in me as a specialist in this area reviewing your case, I don't claim to know everything, but I have a ton of experience doing this, and I would love nothing more than to review your case. There is no charge for the call with us and or for us reviewing your case. I don't believe it's ethical to charge people before I feel 100% confident I can help. Hopefully that sounds fair and reasonable. Know that I am here just to help you out. All right. Then what you can do is you can click the link below, again, in the pinned comments or the description. Click on the apply link. It'll take you to a schedule page. You can set up a time to chat with us. And then afterwards, you follow instructions to submit a detailed case review. All right. That case review comes across my desk. I review it personally. If for whatever reason, after reviewing it, I don't feel confident I can help, I'll just probably give you a call. I'll just let you know. Okay. And obviously provide you with some alternative recommendations. If I do feel we can help, then we can talk about what that process looks like. All right. So that is all I got. Hopefully this was useful. And again, this entire algorithm was designed to show you if piriformis syndrome or deep gluteal syndrome is the cause of your buttock pain through a process we call diagnosis by subtraction, ruling things out in 6 simple but very detailed steps. Thanks so much, everyone. This is Dr. Charlie. Let me know your thoughts below in the comments.